Welcome back to Anatomy and Physiology, Chapter 5. This is the last video, video number 17. So in this video, we're going to finish our injuries or conditions related to skin. So the first one that we're going to talk about are burns. And we can divide burns into two big categories, and then each one has two. So the first category are partial thickness burns. And the two types of partial thickness burns are first degree and second degree burns. First degree burns only affect the epidermis, and they usually cause redness and pain. So we have a little bit of pain transmission down into the dermis, but it really only affects the epidermis. Second degree, we have the epidermis and dermis. We have first degree redness and pain plus blisters. Now, both or all these partial thickness burns, they will heal over time. But we have to make sure that we keep the area clean, especially with blisters. So sunburn can be first degree, and we know that sunburn can hurt a lot. But if we maybe spill boiling water on our hand or our arm or our leg and it blisters, we can actually develop second degree, a little bit more serious. If it's kept clean and the blisters, if they do break open, we keep the area clean, free from infection. Those will heal over time, but it's going to be very painful. And then when we have full thickness burns, these are the ones that are just horrible. So third degree burns and fourth degree burns. Third degree burns extend the whole way through the epidermis and dermis. And both layers are destroyed. So these burns, usually they will have to debride the skin, which means they have to peel off the dead skin. It is an extremely painful procedure because they have to go down to the live skin. Now, whenever this tissue is destroyed, it destroys the nerve endings, but adjacent tissue that hasn't been destroyed is going to be very, very painful. Fourth degree, it is basically full destruction of the skin, the hypodermis, and it affects muscle and bone underneath the skin. So these are the worst types of burns that you can get. These will not heal and require grafts, skin grafts, or tissue cultures. It can be from another person's skin or it can be from your own skin, but the skin will not come back at all with these burns. The online textbook goes over the percentages of the body that are affected, and I am not going to put up any pictures of full thickness burns. In fact, I'm not going to put up any pictures of burns because they are really, really awful to look at. You do not want to see these pictures because it can just be devastating. If a full thickness burn, especially fourth degree, is over a certain percentage of the body, there's usually no way to save that person because there's so much underlying tissue exposed that infection is inevitable to set in, and it usually is a fatal injury. So usually they will try to make you as comfortable as possible in the hospital. The last two things that we're talking about are scars. We've already mentioned scars in chapter 4, so I'm just going to put see chapter 4 notes, because scars basically deal with wound healing, and we talked about scars, the formation of scar tissue, and those different things. But keloids are an overproduction of scar tissue. And this affects some people that they get these raised bumps if they had scars forming. And it looks a little bit weird. And I'll put up some pictures of keloids so you can see those.